Hello again and welcome to The Nation. Blood health isn't something most people think about until there's a problem. Yet it plays a crucial role in everything from energy levels to immunity and disease prevention. But how do we actively maintain it? And is there a structured approach, like following a recipe? At the same time, blood is essentially a liquid organ. Yet, unlike the heart, where prevention and treatment come first before a transplant, blood-related issues often skip straight to replacement or, as we know it, transfusion. Why is that, and is it the right approach? Joining us today on The Nation are two leading experts in hematology, Dr. MANDY Yap Yi, consultant hematologist at Hospital Ampang and president of MyPBM. We also have Dr. JAMEELA SATHAR, consultant hematologist at Hospital Ampang and a founding member and past president of MyPBM. Now, as they prepare for the upcoming MyPBM conference, Recipe for Optimal Blood Health, we take a hard look at the realities of blood health in Malaysia. What's working, what's not, and whether this recipe is actually practical for the average Malaysian. Welcome, ladies, to the show. Thanks for joining us today. So, speaking about blood health, first of all, let's understand blood health. It's a term that the public, that we don't hear it very often, right? Blood health. Was this concept created to push awareness, or is it a real health concerns that Malaysians are overlooking? Maybe we'll start with you, Dr. JAMEELA.
Yes, blood health is not just about pushing awareness, but it's a genuine health problem. And I think that we are not taking blood health seriously. Blood is so very important for optimal physiological functions in our body.
Right.
Yep. And you know, and what happens when blood fails? It leads to anemia, and the leading cause of anemia is iron deficiency. And iron deficiency is a major health problem. It's so rampant. It's iron deficiency is so common among children, among pregnant mothers, among adolescent women, those women who are menstruating, and even in the elderly.
Right.
Yep. So it's so very important. Yeah.
Dr. MANDY, anything to add on to that?
About blood health.
Yeah,
Exactly like Dr. JAMEELA mentioned. If we just pay a little bit of attention to this anemia that we can go through by screening as well as detecting it in our common populations, we can easily tackle this, and basically we can overcome a nation's problems.
Okay, so just to have a general idea, what are some of the most common issues or health issues that concerns our blood?
I would say there's iron deficiency anemia. Dr. JAMEELA, what do you think? The common cause of anemia.
Is that a very common thing that happens in Malaysia? Most Malaysians, do we lack iron?
Yes, I mean, it's so, like I said, it's so common in children, pregnant mothers and menstruating women. And there are studies to show that more than 80% of our women in Malaysia are iron deficient. The women who are pregnant,
Right.
And
why is that? Is it
is
it because of a diet, or what causes iron deficiency? What causes anemia?
In women, it's our monthly menses. We lose blood every month.
Okay.
And then women, of course, undergo childbirth, and we lose blood. And if we lose blood, we lose iron. So that's the most common cause of anemia.
And for children, I would think that their diet nowadays are pretty much like with fast food.
Right.
And they usually drink a lot of milk.
Right.
They don't really take in a lot of solid food.
Solid foods, real foods. Yeah. Okay. Dr. JAMEELA, you mentioned women a lot, right? And this is a common knowledge, we go through our monthlies. But what about men? Are men not iron deficient?
Generally not so.
Okay.
Yes, generally, because they don't bleed. Unless usually if they have an underlying gut problem or cancer, yes, then that's that could lead to anemia. But in general, men don't have issues with anemia.
Right. Okay, so you mentioned gut problems, right? And I'm guessing a lot of men have a lot of gut problems. What exactly are we talking about when we say gut problems?
Yeah, I mean, that points to usually, I would say, bleeding from piles maybe, those kind of problem. Or in the elderly, it's cancer of the of the intestines, of the large
Or colon cancer.
or stomach cancers.
Right.
So for men, it's usually those, you know. Yeah.
Okay, so
Because
in the case of
where
men,
else
it's
would they
usually
bleed? Yeah.
chronic
Yeah.
illnesses.
Yeah.
All right.
And for men, it's usually chronic illnesses like kidney failure, heart failure. That can lead to iron deficiency.
Okay, well,
Yeah.
that's new information for me and also for our viewers, I'm guessing. Dr. Mandy, we mentioned the term recipe, right? And that sort of suggests that there is an ideal formula for blood. But in a country where many people struggle with even basic healthcare or even the basic awareness for looking after themselves, is this recipe realistic, or is it just, you know, a concept that we aspire to?
I think it's very realistic if you just manage to, you know, screen them and pick up the iron deficiency among the patients, and you correct it accordingly. For sure, you'll be able to be the recipe of the optimal blood health, right? Like just Dr. JAMEELA mentioning all the causes. You'll be easily fixed rather than resorting to transfusion, like where we find the easy way out.
Right. So when we're talking about this recipe, what are we referring to exactly? Are we referring to our diet? Perhaps you'd like to elaborate a bit on that.
Right, this will be going to include a lot, including not only diets. We'll be talking about even how we approach, how we manage, how we treat. Yeah, and just now we were talking about how we screen. And later on, maybe we will even touch on further up, how do we actually implement it to the whole country, right, Dr. JAMEELA? Yeah.
Okay, so before we talk about improving blood health amongst Malaysians, what are the biggest barrier that Malaysians face right now when it comes to blood-related conditions? Apart from anemia, I would imagine other blood-related conditions would include blood cancers.
Blood cancers, bleeding disorders, among others. Yeah. So I think increasing awareness is very important. Among the public as well as the healthcare providers, because I just had a patient who had gum bleeding and bruises for a week, and he has seen 3 doctors, and they couldn't find what was wrong with him, and they kind of brushed it aside, thinking that this is, you know, gingivitis, and it turned out to be leukemia. You know, so it's very important to actually be aware, to suspect, and for the public out there to seek, don't be just satisfied with, what the doctor, one doctor tells you. You need to get a second opinion, because leukemias, if you diagnose early, you can cure them.
Right.
Yeah.
But what's contributing to these misdiagnoses or late diagnosis?
I think
lack of
recognition.
awareness. Lack of awareness.
And
lack of awareness from the part of
both
the patient or
the practitioner at the same
and
time,
healthcare
the doctors.
providers.
right.
Both, yeah.
Okay, there are 2 parts of this. When we talk about awareness, us as patients or as people, we need to be aware of how our body functions. If we are healthy, etc. And also, medical practitioners also need to be very diligent with how they look at their patients.
Yes.
We would, as a regular person, we would imagine that doctors have the experience, the expertise to be able to pick up on all of these little symptoms, and what would be the cause of them not being able to, or not having that awareness, like you mentioned?
But I would say that like leukemia, Dr. JAMEELA pointed out, is kind of like very niche. A lot of doctors wouldn't recognize it.
It's considered a rare disease.
Yeah, because we are hematologists, so we would know how to.
But I would say actually the symptoms of anemia is very non-specific.
Correct.
Okay.
Yeah, they have like dizziness, headache. They feel tired. Yeah, so it's very non-specific, and symptoms of iron deficiency like hair loss. Brittle nails. Or a condition whereby you tend to like to eat ice. That's actually a sign of iron deficiency.
Yeah.
Is
Eating
it?
ice,
Yes.
So all these symptoms are non-specific, whereby the public is not aware, even the doctors are not aware. Just feeling tired or brain fog. Can't think, and usually women experience this because most women are iron deficient. So they kind of brush the symptoms off as, they just blame it. Oh, this is probably my monthly, menstrual cycle or all that,
PMS.
Yeah, PMS.
You know, your colleague would say that, yeah.
And they don't seek, they don't think it's just non-specific, and they don't seek attention. And doctors don't realize that these are symptoms of iron deficiency.
And they brush it off as just,
They normalize it.
Normalize it.
Yeah.
Okay. Speaking of that, it does sound as if there is a part of the system that's broken, and despite all of our medical advancements, we, like you said, still see very, very high rates of anemia, blood disorders, and also transfusion dependency, and this we see a lot. What exactly would you say is broken in our system?
What do you say? I would say that we tend to underestimate the importance of blood health on our overall health.
Okay.
And like what Mandy said, we tend to normalize anemia. We think it is secondary. It's not important. We wait until severe complications arise. We are being very reactive. We are not proactive. Meaning to say that we wait until her symptoms get more severe, until she's very anemic. Then you'll do something. So now the focus here is on more prevention. That means know what your hemoglobin is. What is your iron, your ferritin? Iron, you measure it by your ferritin. What is the level of your iron in your body?
Content in your body.
So because most of the time, people are more focused on cholesterol levels,
Right.
Blood sugar level.
blood sugar, but they kind of brush aside your hemoglobin. What's my ferritin? When you look at sometimes you go for all these blood checks, there's no ferritin in there, right?
What's a healthy level? Hemoglobin
Hemoglobin across all
Women and men.
Men, women, children, it's 13.
13.
Anything anything below 13 is anemia, right?
But we wouldn't know unless we go and get a blood test done, right?
Yes,
so
yes.
now we're thinking, are we supposed to get our blood tested regularly? Is that what we're supposed to be doing? If so, how regularly?
For at-risk population, such as children, right? We advocate for children from 9 months onwards. They should get a screen for hemoglobin and iron
deficiency.
And then yearly or 2 yearly after that, depending on if they are iron deficient. You can get actually iron deficiency without anemia, right? Yeah. So you can be iron deficient without going on to anemia first. But if we don't address iron deficiency, they can all
then you become anemic.
So you need to do both. Do a hemoglobin and do a ferritin level.
So are we saying that the healthcare system, like we've completely overlooked this part of testing? Like you said, we check for blood sugar, we check for high blood pressure, but we don't check for how healthy our blood is, Dr. Mandy.
We do check full blood count, but I think in terms of like checking iron, we don't really routinely doing it. Yeah.
Right. Okay. So we always hear about diet and exercise, to improve overall health. But can it truly prevent or maybe even reverse blood disorders, or saying that is an oversimplification?
I think it comes hand in hand with medical treatment, but diet is important. I always tell my children to take iron-rich foods. What are the iron-rich food? They're chicken liver. Most people don't like when they say liver.
I've got to admit, it's not my favorite.
Yes. It's highest content of iron.
Right.
Chicken liver, cockles, red meat. And these are the animal sources.
Right.
And the plant sources are the green leafy vegetables. Right, like your bayam, spinach, kangkong, swamp cabbage. Even
on that note, since you mentioned vegetables, now I'm very sure there are many Malaysians out there who are vegetarian and also vegan.
Yes.
In those cases, what would be a intake that is enough for them to make sure that they have their iron levels up?
So rich iron, vegetable sources, like I said, green leafy vegetables.
Right.
But you know that iron is poorly absorbed from plant sources. So to enhance the iron absorption, you should encourage them to take with foods that are high in vitamin C, such as broccoli, those green bell peppers, yep, or take it with fruits after your meal, right? With, citrus fruits, you know, lime, juice of lemon.
But just
lime
talking
or
about
lemon
the
juice.
amount or like the quantity that they should be eating, because they're not getting their irons from animal products. So I'm guessing they need to really up their intake.
Probably like
I'll
at least
take
5
supplements.
servings a day. Like,
Supplements,
yeah.
yeah.
That's 5 servings a day for
Yeah.
those of you who are vegetarian or vegan,
Yeah.
to make sure that your
Yeah.
iron levels are at the optimum level.
Yeah.
Dr. Jameela, also let's talk about blood transfusions, right? Often it's the first response to anemia or blood loss, and this happens during surgeries. But what's the real cost, both medically and also systemically, of over-relying on them? Because we know, we have a blood bank, and they're always saying that we're short on blood, and they're always asking the public to come out and to donate blood. So are we over-relying on blood transfusions?
That's why I think, we are over-relying, because there are many patients who come with anemia, and doctors usually, their reaction is to transfuse blood. When they see hemoglobin below 8, they will transfuse blood, but that's not the right thing to do. In Malaysia, we transfuse about 850,000 bags of blood per year.
Right.
That's 2,500 bags per day. And the cost of one bag of blood, taking the acquisition, storage, testing for all the viruses, and cross-matching and giving back to your patient and managing all the transfusion reactions that occur, one bag of blood easily will be about 1,500 to 2,000 ringgit per bag. That's how costly blood is. And we transfuse 2,500 bags of blood per day. And studies have shown that 90% of these transfusions are actually not appropriate and can be avoided. So if we actually, manage our blood health properly, we can actually reduce the rate of transfusions by more than 50, maybe up to 90%.
Right.
And imagine we can save billions of ringgit
For the
a year.
ministry.
Yeah.
Right. Okay, so it is my understanding that there are 2 schools of thought when it comes to blood transfusions, right? There are those practitioners who are pro blood transfusion, like you said, any little problem, blood transfusion. However, the 2 of you are on the opposite side.
Yeah.
Let's try to understand why this is so, Dr. Mandy.
Because we realize that we are actually hematologists, used to be studying about transfusion, and we're handling a lot of this complication of transfusion, with all these transfusion reactions, ABO incompatibility, they transfuse wrong blood group, things like that can be very fatal, the complications. So we realize if we just address their own blood without transfusion, it has much better outcome, right, Dr. Jameela?
And most of the time, who gets transfused is the women. And when you transfuse blood to a woman, there's a risk of aluminization. Have you heard of aluminization?
No, please,
That
doctor.
means your body, the woman will make an antibody against the blood that is being donated.
Right.
The donor blood, right? And these antibodies later on will pass, when they get pregnant, when the mother gets pregnant, it will pass through the placenta and destroy the fetal red cells, because the donor blood is never 100% matched with the patient, right? So they produce antibodies and later on cause problems, and the child may get hemolytic disease of the newborn.
Meaning the red
Fetus,
cell
meaning
will
that the
lyse.
red cells will lyse. And that's why sometimes women comes with recurrent miscarriage or fetal death,
Right.
because the antibodies that was made towards the donor's blood will then attack the babies. Because when we cross-match blood, we don't give fully matched blood. We only cross-match against the blood group A, B, O, and big D, right? There are more than 300 over antigens on red cells. We don't match.
Wow.
Yes, so that is the problem, So we women, especially women, we need to look after our blood health. And women, studies have shown that women who are iron deficient during pregnancy, there is an increased risk of their children having autism spectrum disorder.
Right.
Yeah. And if a woman who's pregnant lacks iron, you need iron for your muscles to contract, right? So the number 1 cause of postpartum hemorrhage is uterine atony, because the uterus can't contract because of iron deficiency. And then later on, following childbirth, they can get postpartum blues. Postpartum depression is associated with iron deficiency, because iron is so very important. It's important for brain development. It's important for collagen synthesis. It's important for DNA repair. It's important for immune function. So many other, reactions for thyroid hormone synthesis, because iron has got redox potential. Yep. When you transfer an electron from 3+ to 2+, that electron governs a lot of reactions in your enzymes. So iron is so very important. So we must make sure that we eat a healthy diet. And for those who are at risk, children, women, pregnant mothers, the elderly, they should screen for iron deficiency and make sure they take iron-rich food or supplements if they can't take iron-rich food.
So, doctors, I'm guessing this whole conversation around blood can get very deep and very technical. You were mentioning ions and stuff like that.
On and on.
I hope you understood. Was that difficult?
We don't have enough time to talk about all of it, but basically bottom line is to keep our blood healthy and for blood transfusions to be the last resort, if at all. Let's move on and talk about the MyPBM conference and the future of blood health. Your conference is called A Recipe for Optimal Blood Health. Is this another expert-led discussion, or will it actually lead to real policy shifts and how our country and our healthcare system approaches blood health?
Definitely is going to lead to paradigm shift in the whole country, because we are inviting our health minister to join the conference, as well as the head of the medical development divisions from Ministry of Health, all these stakeholders and policy makers. Dr. JAMEELA, thanks to her.
So it's not just within the clinic, clinicians.
So it's not
actually
conversation and hoo-ha within your own community, but we are looking at real change to happen. If there is one immediate policy that you would like to see changed to improve blood health and how we manage how treatment for blood is being looked at, what would it be, Dr. Mandy?
Just now we had a discussion. I think we shall look into the screening of iron deficiency anemia. Secondly, I think we need to really judiciously for the blood transfusion request. Basically, it has to go through a gatekeeper.
And to implement patient blood management. Patient blood management is a new it's not actually a new concept. It's been around since 2012. It's about patient safety, patient-centered care, improving patient outcomes, patient safety, patient empowerment. We're just focusing on the patient. And also I think that we should have a framework whereby, the public health, the primary health care, hospitals, they come together, and work together to actually improve blood health. It should be a prevention approach rather than a proactive approach. So we should all come together, and to make this work. And I think we have actually set up a
national task force.
A national task force on looking into all this, and we hope that we will succeed, in getting, in working together. It's not easy to work together, even with the public.
I imagine there will be a lot of
we have
challenges.
To all work together.
Not just with the public. I mean, because it's it's common for us to assume that blood transfusions are a common procedure that's done very often. It is going to be, your work obviously has been cut out for you, and it's going to be a long and bloody journey. I'm sorry, I just had to put in that pun. Ladies, thank you so much for joining us on The Nation today. For all of our viewers out there, blood health often goes unnoticed until it doesn't. And today we've uncovered the critical role it plays in our lives, from prevention, which is very, very important, to treatment, and questioned if there is truly a recipe for optimal care. Don't forget to up your intake on the iron-rich foods. I'm PASHA RAHIM, and we'll see you next time on The Nation with more conversations that matter to your health. Take care. See you soon.